Thank you very much, Dr. Satayr, for giving me this great chance to be with you. After these nice presentations about the pseudophakia and their problems, let's go back to the cornea and my presentation about the surface ablation and long life for PRK, or surface ablation not to forget. The question, did the flap-related procedures make PRK obsolete? Multiple authors around the year of 2000 published a lot of reviews about the fading out of the PRK by coming and raising of the LASIK and the flap-related procedures, but it is not real because the PRK is still alive and coming again to fight. Let's talk about that, but in not the commercial way, which is should in the last time, but it will be a different time. This pictures and this street sign I captured from the street, where some of eye surgeons giving advertisement about the PRK as a bladeless laser procedure, telling the patients that the bladeless is much more recent or advancement of the LASIK surgery where there is no flap, but actually the PRK is bladeless from the start. It's not new. But they were talking about it as the PRK is a new matter, but it's an ancient. The advances of surface ablation passing from the PRK using the alcohol or the hockey knife for the mechanical debridement, then to the LASIK, where the flap is removed after alcohol application to the epithelium, but keeping the flap to reposit it again after finishing the procedure, and passing to the epi-LASIK, where the epithelium is removed as a flap with a planted plastic plate with microkeratoum like that of the SPK. And this is the conclusion, the summary of my table. When there is a flap in the surface ablation, there is less pain, delayed visual recovery, and the faster epithelial healing. But with the PRK with no flap after the removal of the epithelium, there is more pain, faster visual recovery, delayed epithelial healing, and the PRK is the most popular method of the surface ablation nowadays. About epithelial removal, which method you will prefer? Doe et al. 2003 stated that the mechanical debridement is much less than the alcohol-assisted mechanical epithelial removal because the mechanical debridement will be traumatizing to the surface, leaving behind an irregular corneal surface for the ablation. Actually, like in the upper picture, this is the surface after epithelial removal. It is homogeneous and smooth. And this is the picture to the left down. There is a complete, regular, and smooth surface between the removed epithelium and the remaining Bowman's layer. But on the other hand, the Qureshi at 2010 stated that both are almost the same at the end. The mechanical debridement and alcohol-assisted epithelial removal are the same about the visual recovery, about the pain, about the haze. They are almost the same, and it will be left for the surgeon preference. I should be fast because the time is out from now. So, on my experience and observation in this field, I found that the alcohol-assisted epithelial removal was equal to the mechanical debridement if you met loose epithelium. But if you met a case with tough epithelium with subepithelial fibrosis, I think the alcohol will assist you much better than the mechanical debridement. to leave a good surface with extremely smooth surface for ablation with better post-operative results and more predictable correction. But about the healing and post-operative pain, it's doubtful. It's not with fixed rule. But you have to use 20% ethanol for 10 to 15 seconds, not more. So which one of them you will decide after that? Mechanical or alcohol? I will leave that to you. Finally, trans-PRK, the most advancement of the surface ablation to remove the epithelium and correct the surface together with the excimer laser, 2-in-1. As shown in the Amaris platform in Schwand, and also the transepithelial in Vesics, and recently in the Wavelight, Allegretto. The transepithelial PRK is much advantageous than the other methods in the following, that it keeps regular and smooth surface. And the most beneficial issue, that there is no irregularities in the surface, so I think experimentally and theoretically and also practically, it will leave a smooth surface for more predictive correction by the laser ablation. Especially if you met an irregular corneal surface in trachomatous patient where there is a lot of subepithelial fibrosis and corneal vascularization, the transepithelial PRK will help you to remove the epithelium in a simple and smooth way. It's also advantageous in the matter of the profile, the ablation profile adjustment. If you did transepithelial PRK using the wavefront guided, you will find that it's more and much better ablation, and with visual recovery and with visual quality rather than the PRK and also the LASIK. By the similarity of the profile of ablation between it and the other methods with the pre-operative topography. Finally, this is a very important matter in the transepithelial PRK to measure the epithelial thickness, because the Amaris platform is based on the epithelial thickness of 55 microns in center and 65 microns in the periphery. So you have to know the epithelial thickness for this patient, either less or more than 55, to adjust your refraction, which you will put in your device to correct. Either thinner epithelium, you will add error, or thicker epithelium, you will decrease your error in your entry to this device. The epithelial measurement could be, could be more accurate by the anterior segment OCT. Finally, I have to skip all these figures. But the question remains, when you choose PRK, then the other procedures, when you find a suspicious patient which is not diagnosed as a conus and in thin cornea, and in any patient with low or very mild risk factors, and finally, if you did a patient with surface which is sharing in sporty and in contact sports especially. Finally, let me to finish my presentation by this slide. The PRK and the other procedures are the same destination, but with different journeys and different methods of transportation. The PRK could be like this train, and the LASIK and other flap-related procedures could be like this airplane. But the train may be like this train, or like this train according to the patient's status, conditions. Anyway, you will arrive. The important point to arrive safely I wish a nice trip for all of you, and thank you.